But I'm going to talk to you today about the MSc in Medical Imaging. So this is an MSc program for people who perhaps don't want a specific modality MSc. Next slide, please, Shane. So with this program, it's worth 90 credits, and you'll see that in year 2, you do a dissertation, which is worth 30 credits. And in year 1, you take a module called Research Methods, which is worth 10 credits, and that's compulsory. And then you can choose from a series of modules that are on this slide. So you can mix and match according to your own personal and professional interests. So you can see here, there's some technology modules, there's radiation safety, there's cross-sectional anatomy, there's DEXA. And you'll see at the bottom, we have a suite of modules, suspected physical abuse, which was formerly non-accidental injury. So this is related to injuries in children. This is a very interdisciplinary module, and this will look at radiographers and other professionals' responsibilities and interactions with children. We have another module, legal, child welfare and protection, which again looks at the radiographer and clinician's responsibility in relation to children that you're imaging or you come across with child protection issues. And we have legal responsibilities in child protection. Now, legal responsibilities looks, as it says, like at the responsibilities as a practitioner that you have. But one of the selling points of this module is that you get the chance to write a report for court and to give evidence in a court with solicitors and be cross-examined by solicitors. So this is the closest you'll ever get to being in court without actually physically being called. So the last 3 modules are very interactive, and you learn alongside a variety of other professionals, such as police, teachers, nurses, doctors, and other clinicians. Next slide, please. So the unique selling points of this program are that the program is actually built around the student. So you can mix and match modules that suit your own personal and professional goals at this particular time. And the modules are delivered in a variety of formats. So as this year, it's pretty much everything's been online. But some of the modules are delivered online. Some are delivered via a mixture of blended learning, which might mean 1-day attendance in UCD. And some of the modules are delivered by attendance, but it's very different depending on whatever module. Why would you want to take this course? Well, the selling point of this course is it's ideal for busy practitioners that have like family and work commitments. And the course is built around the student. So you can study the modules that you think are more useful to you at this particular time. And you can apply them to your own personal and professional practice. You also have the ability to study in your own country. So there's not necessarily a need to come to UCD, depending on which modules you want to take. And you also have a chance to apply what you've learned in your own country. So a lot of the assessments are very relevant to what you're actually doing. And for the dissertation, you've got the chance to research something that you're very, very interested in relation to your own personal and professional practice. Next slide, please. So some of the frequently asked questions are, do you have to physically attend UCD for all of the course? And no, you don't. Can you study while working full time? And absolutely. So the majority of the people that take this program are working full time, and they've got busy, home family lives. So it's totally doable. Do you need to take modules from outside the university? No, you don't. So there's some information here on the link here that you can follow up if you wish to. There's my email address if you have any questions, and I can take some questions at the end as will all the other panelists. So have a think about it and get in touch if you're interested. Thank you.
So I'm just going to talk a bit briefly about the professional certificate in radiation safety. So we've had lots of interest in this course over the last couple of years, thankfully. So what is it, or what's the course overview? So it's a 10 credit or a 10 ECTS credit module. It's 4 months in duration. And the stuff or things that you'll learn about in the course are physics and the units of radiation and dose measurement, methods of dose reduction, and radiation safety guidelines and best practices. So it's tailored specifically to professionals working in the area or working with ionizing radiation, and specifically for people who want to maybe improve their knowledge of radiation safety and best practice guidelines. So you'll also develop a deeper understanding of national and international legislation governing radiation safety in your own country, whether that be Ireland itself or internationally, and understand how you fit into this as a professional and how to apply it effectively to your work life. You'll be able to critically evaluate radiation safety policies and procedures in your profession and understand your role within them, and hopefully examine current issues in radiation safety and apply these to clinical and industrial decision making and problem solving processes as well. Next slide, please, Shane. Thanks. So what are some of the unique selling points of the program? So it's a part-time course and tailored to the working professional. Okay, so that basically means that a lot of the assignments and submission dates for these assignments are on evenings or weekends. So it allows the students plenty of time to complete them. Most of the content, it's completely delivered online, and most of the content is timed in such a way that it allows the student as well plenty of time to catch up on the actual material itself and then complete the assignments within good time. So we haven't, thus far anyway, no students have, or well, we found that students have had plenty of time to complete them, and they haven't been under time constraints that we're aware of anyway. It's completely remote, it's completely online, and can be completed anywhere. Obviously, you need access to reliable broadband, but the timing, I suppose, at which you complete the tasks is up to yourself. The assessments, however, are timed and should be submitted within a certain time frame, and that'll all be communicated to the student when they commence the course. So another unique selling point is that it's currently the only professional certificate program in radiation safety that I'm aware of anyway. I couldn't find any other. So we have quite a lot of students coming from all over the world to complete, which is great as well. We also have lectures that are created by and delivered online by leading medical and industrial radiation safety experts, as well as some academic experts in physics. Again, another unique selling point is that it's completely assessed by continuous assessment, so there's no actual end of semester exam. So like I said, just timed assessments, and the student will be given those dates of assessment when they start the course. So why should you take the course? So you should take it if you want to improve your knowledge of radiation safety and legislation, to understand better your role in radiation safety and develop skills and knowledge to become a better radiation safety officer or radiation worker, and to be able to effectively apply this knowledge and skill in your role for effective problem solving. Next slide, please, Shane. So eligibility is the next one. So this is quite a commonly asked question, actually. So you should have, one of the following should apply. So like I said, we do have students from internationally, lots of students, but also students from lots of different backgrounds. So because it's a professional certificate, one stipulation is that the student should be currently employed in a role in which they use ionizing radiation, and that's governed by radiation safety legislation similar to our own in Ireland, but it doesn't have to be that one exactly. Also from clinical background, so you should have one of the following. So they are a BSc in radiation therapy or radiography, sorry, a BSc in physics or equivalent. If you're a member of the Medical Council or on the register of the UK General Medical Council, an individual named on the register of dentists held by Dental Council of Ireland, if you're a nurse registered with on board alternate, or if you're a member named on the register of Veterinary Council of Ireland, or the members of the Royal College of Veterinary Surgeons. Or next slide, actually, Shane, please. And then last one in that category is if you should have a good standard of education, minimum of leaving certificate or equivalent, with evidence of ongoing training in the area of radiation safety and professional experience in the field utilizing ionizing radiation and operating under current legislation, okay, which is in Ireland it's SI 256 or SI 30. But like I said earlier, if you are in a country with equivalent radiation safety legislation, that's sufficient, okay? But the reason being that this is a professional certificate, so we kind of expect that the students should have kind of some bit of prerequisite in it. But then all of the following should apply. Okay, so the student should currently be employed in a facility which uses ionising radiation within the state regulated and licensed by the Radiation Protection Institute of Ireland or similar regulatory body, or licensed facility internationally. They should demonstrate a commitment to continued professional development within the realms of radiation protection, and you should have some level of computer literacy and have continuous internet access for the duration of the program. Now, don't be put off by the words computer literacy. Okay, it doesn't mean that you need to be a whiz, but because obviously it's completely online course, you will have to engage quite a lot with with the module online, but of course I'm available throughout the whole course for any help that you may need. Okay, and also obviously UCD have quite a lot of help in the IT department if you're finding it difficult. So then last slide please, Shane. So just some frequently asked questions again. So how long is the course was asked quite a lot as well. I kind of said it at the start anyway, but it's a 4-month course. So there's two offerings, one in January and one in September. Okay, so 4 months each. Another question, I suppose, leading on from that is, can I start the course when it suits me, or when can I start it whenever it suits the student, basically? And the answer is no, unfortunately, because the course has the 2 offerings and the assignments are timed and due at certain times during the course, it is necessary for the student to pick one or the other of the 2 starting dates, so either January or September intake. But other than that, there is a lot of flexibility around the course. Otherwise, like I said, it's tailored for the working professional. So we do allow for quite a lot of time for assignment submission. Okay. Can I still use an on-campus facility? So because it's all online, obviously there is no requirement for you to attend for any lectures, but you can still use the facilities on campus, and they are still available to you because you're still a student of the college. So you will have access to all amenities during the course. So if you have any questions other than those, I'm happy to answer them at the end, or you can email me at that address there.
I'm glad to have the opportunity to just talk a little bit about our DEXA program. So it's a professional cert in DEXA imaging. It's a 10-credit module, and it focuses on DEXA in the clinical setting. It's carried out over 1 module, so it's delivered over a 12-week period. Historically, we have run this module in the autumn trimester, but it's now being moved, so it will run every spring trimester is the plan. So this slide just gives us a kind of an overview of what we cover in the course. We think it's really important. Sometimes DEXA is a modality that maybe hasn't been covered kind of historically, or it's been quite a while since somebody has worked in it. And so we like to cover the physical principles and a little bit about how the system works, just in order to give kind of some theory into the background of how the DEXA scanner works, so you can use it to the best of its of your ability and what it can offer your service. And we also cover scanning and analysis techniques in relation kind of with best practice standards, but also on how to apply these, because when we work in individual settings, different patients present, and so it's learning how to interpret those best practice standards with kind of the cohort of patients that we see. We also look at vertebral fracture assessment. Now, this isn't something that's routinely done in every DEXA service, but it is fast becoming an important kind of tool to be used alongside the BMD measurement. And certainly the Royal Osteoporosis Society are very anxious that vertebral fractures be kind of taken into account when looking at a patient's bone health, and they're putting a big push on that. So kind of understanding how to carry out that assessment and also how it can add to your result, we cover that as well. And probably one of the more important aspects is looking at serial scanning techniques and how we can apply best practice guidelines. For the most part, if somebody is attending for a DEXA scan, it will be to look for at their bone density, their bone health, and probably they will return and we will want to see if there's a change. And so in order to know if there's, the change is real, and we do have to be sure that our service and our scanning is consistent and it's reliable, because otherwise any changes then can't be deemed to be true changes. So that's something that we certainly look at in some detail. The next slide. Okay, so the unique selling points of this program. So this program has been designed and has been offered online historically. So before we all, had to dash to Zoom because of the current situation, we had developed this module to be offered online, because we certainly understand the challenges that there are to get away from busy clinical environments. And so the content of this module is delivered, the lectures are already recorded with notes, and they're released at 3 different times over the 12-week program. And it's very much student-led. It's up to the individual student how they would like to approach their learning. For some students, they like to put an hour or 2 aside each week. Some students like to spend, a full day or a weekend. So we, very much encourage the students to decide which approach works best for them. Obviously, throughout the 12 weeks, and especially as the content is released, I'm available always by email and for any questions. But we also, because we understand that when you're learning online, it can sometimes feel like you're learning on your own. And while independent learning is great, we also really want to encourage you to be part of the DEXA imaging team. There are, few people that are, have experience in DEXA imaging. So we do like to get together for tutorials. Again, they're not mandatory, but they do allow the students to get together as a group with myself, and we can talk through, some of the questions that have come up on the content, or even the application to the individual clinical settings, how we might best approach different patients and situations. So definitely another selling point is that I really like to try and create a team building approach, and just to put those that are working in DEXA in touch with each other, because it can be quite a small field. There isn't clinical placement required for this module. It would be great if you could, go and observe a scan and maybe observe the analysis, because it is a slightly different type of imaging that you may be kind of used to or have experienced previously. So that would be helpful, but you don't need to be scanning as you're taking the module. And so that's probably something that's important to know. Again, we're aware that sometimes when people start working in DEXA, there hasn't been the time to develop that theoretical background. And so that's what we like to do, is to, give our students the theoretical background so that they can apply it to their real, real clinical situations. So you don't have to have worked in DEXA previously either. That's not a prerequisite. Just the willingness to learn and learn a new modality is great. The assessments are particularly developed to help you apply your knowledge to clinical settings and clinical environments, because essentially at the end of the day, that is what we're trying to encourage, that clinical practice is based on best practice, with kind of as much knowledge as can be gained. Like I said, there is no time, there's no on-campus time. You don't need to take, none of the lectures are as such live. They're pre-recorded lectures, so they are available for the students to undertake at a time that absolutely suits them. And when we do have our live tutorial, we do try and schedule that for a time that suits those that are, that want to join. Probably just something that's important to say is that this module is open to those working in various healthcare settings with a background in healthcare, but it's important to know that completion of this module does not as such give the student permission to operate a DEXA scanner. That's very much underpinned in the legislation. So while it will give you the theory and the background, it doesn't actually give a license or an allowance to scan if you're not one of the those mentioned within the legislation. So that's just something that's probably worth pointing out. So if there's any questions, I'd be happy to take them now, I think, if we've reached the end.
So I'm just basically going to talk about the graduate certificate in obstetric ultrasound. This program is 18 months duration, so it's a year and a half to complete, and it's equivalent to 30 European credits. And basically what this program does is as it confers clinical competency in ultrasound for obstetrics at fundamental level, and that's where it's quite different to the MSc program, with the MSc program obviously conferring competence at a higher level. There's 4 modules that are associated with the program. Each one takes 6 months to complete. So the first module is early pregnancy ultrasound, and this takes place every year from January to June, and it starts off with a study day in UCD in January, which is, has compulsory attendance associated with it. The second module then is fetal biometry, liquorn, placenta, which is sort of a basic second and third trimester ultrasound. And this takes place between July and December, so follows on from early pregnancy. And there's also a study day then associated with this module, and that's in July. And again, it is compulsory attendance. Now, obviously this year these have been virtual, but normally that second study day actually takes place at the National Maternity Hospital or at the Coombe Maternity Hospital, with live scanning of patients in the afternoon. And then depending on, like a lot of those who will take this module will be NCHDs that will be moving around their clinical placements every 6 months. So depending on what your clinical placement is then, the third module would either be fetal wellbeing ultrasound, which is sort of more, looks at more sort of structural abnormalities, etc., and more slightly more detailed second and third trimester ultrasound, or a gynae ultrasound module. So obviously, depending on where you're going to be working and which kind of ultrasound you're going to have better access to, you would choose one of these 2 modules for the third module. And again, these take 6 months to complete. So Shane, if you could move on there, please. Thank you. Okay, so associated with the program then and these modules, we have some other offerings, and they are for those who want to just take early pregnancy ultrasound. We have the professional certificate in early pregnancy ultrasound, which is exactly the same module, again, compulsory study day in January and runs from January to June. We have the professional diploma in obstetric ultrasound, which is the first 2 modules. And again, both the 2 compulsory study days and runs from January to December. Or we have a professional diploma in early pregnancy and gynae ultrasound. So again, that would just be the two modules, would run from January to December, and it would just be the 1 compulsory study day then in January. And then the other offering that we have for those who have actually completed the graduate certificate, so they've completed 3 modules, they can then take as a standalone professional certificate the module that they did not take as part of the full grad cert. And those modules start in January and July every year. Okay, Shane, if you could move on. Thank you. So I suppose the unique selling points of the programme is, first of all, as I said, there are the 2 compulsory study days, but otherwise all the lectures are delivered via the online platform. The lectures are put up every week, and then when all lectures are up, they're left up then for the full duration of the module. So obviously students can have a look at these lectures and go through them at their own convenience and at their own time. And a lot of the NCHDs would find they would do this maybe when they're on call, for example. All clinical practice then and all assessments are undertaken in the student's own clinical site. So in order to be accepted onto the programme, you must have a clinical placement and also have a named clinical supervisor in your own hospital site. And I suppose this flexibility, more than with the master's programme, has absolutely given us fantastic feedback from current and past students. And, you know, I would already be receiving lots of sort of emails and inquiries about the program starting in January. So, you know, the sort of way the program has been run and the flexibility does seem to really suit a lot of students. So who should take the program? Well, as I've sort of alluded to already, OBS and gynae trainees at either SHO registrar or SPR level, and indeed we've had some consultants who've done the program as well. General practitioners also, and again, some hospitals are very good at taking GPs on board to train, and others maybe not, just haven't got the facility to do that. But some, you know, some general practitioners have completed the program. And then also midwives and radiographers who perform ultrasound in the antenatal clinic or in the emergency room. Because again, as I say, it is a more basic course than the master's. But also those who have an interest in specialising in obs and gynae ultrasound will quite often take the masters. And interestingly, our current master's students, of those that are taking the obs stream at the moment, they have all actually completed the grad cert in the past few years. So it was their way of kind of getting into ultrasound and seeing if they actually were interested and liked it, I suppose. So Shane, if you could just move on to the last slide there for me, please. Thank you. So again, unfortunately, as with the masters in ultrasound, we cannot arrange clinical placements for ultrasound. So this is something you have to organise yourselves. Because again, it is a certificate course, the clinical hours are between 80 and 90 hours. They're obviously over to 6 months. That's obviously the minimum number of hours, but that roughly equates to about 4 hours a week. So what you would need to have done is to have a clinical placement arranged, if you like, one morning a week. Before actually taking the course. And we don't accept anybody onto the program until they have assigned a form that's actually signed by themselves and their named clinical supervisor. Okay, so that's it. So again, any queries, there's the email address there, and as with everybody else, I'd be very happy to answer questions at the end now. I think we're
Excellent.
finished.
Thank you, Mary. So that's it. Wow, that was a quick flight through a number of programs.